with MRCG. For those of you who don't know IPOSI is the Irish Platform for Patient Organisation, Science and Industry, and we operate as a platform between those three groups, but we're very much a patient-led organisation, and we dovetail quite well with the MRCG activities, and will continue to do so over the next coming years, particularly in the area, I think, of PPI. So I think the challenge that was set today for the panel discussion was that I think, and even from my own perspective of someone who's been actually operating in PPI space for a number of years, is that what I think we're lacking in Ireland is not actually the inspiration or the skills, but we need more practices. And I think that the PPI Ignite Award will help to generate some practices. But there are existing practices that are patient-led and that are led by universities that we haven't actually maybe collated in a structured way. And I mean that from the point of view of actually learning from the experiences and maybe some of the challenges that we're experiencing among some of those practices. And I think that the panel discussion today is about maybe highlighting some of those practices and some of those good practices that have emerged from the patient communities and from patients and clinicians working together. So I think that Philip nailed it on the head, that we do need the kind of political leadership that maybe they have in the UK or have had in the UK that have really driven PPI to a level that where it's at right now, and I hope that the leadership being shown by the HRB will be followed by other agencies, but we do really need that higher level just do it attitude to really infiltrate, not just in the research community but in the broader healthcare space. So if I might ask our panelists to come up to the front. We have four, I would call, good practices to be highlighted today. We're going to ask each one to deliver a short summary of what their own experiences has been, perhaps some learnings from those experiences, both positive and negative. I think that it's often something that if we're promoting PPI, it's often something that people greatly appreciate the learnings that have come from maybe some of the mistakes that have been made along the way. So, and I think that was certainly something I took from the examples from Research UK and indeed from James Lind Alliance and the HRB, that it's a long-term initiative and it needs to be constantly evolving and changing according to the practices and initiatives that have been set up. So I might ask the first pair, who are Julie Power, who is someone very familiar to IPOSI, is the founder and chairperson of Vasculitis Ireland Awareness. And Julie is here together with Dr. Eamon Malloy, who's a consultant rheumatologist based out of St. Vincent's. And so Julie and Eamon, if you'd like to maybe give your perspective from your own experiences of working together in a PPI initiative.
Okay, I'm Julie Power, and I founded Vasculitis Ireland Awareness, and I'm currently the chairperson. And I founded it out of frustration because I was very isolated. For those of you that don't know what vasculitis is, it's a rare autoimmune disease, and basically the immune system, for no reason at all that we know of, suddenly becomes overactive and starts attacking various organs. So vasculitis covers about 15 different diseases. There's no definitive diagnostic tool because it's rare. It's very hard to get people that are familiar with the disease. So treatment can be very inconsistent. So anyway, we started off anyway, and I was very lucky that Eamon and Mark came on scene very soon around the time that I founded the organisation, and I liaised quite closely with them. So we've been very lucky in that we have been involved in changing an information leaflet to make it more accessible for patients in the biobank registry. We are currently involved in setting up an AVERT project, which is a 5-year project with a view to being able to identify triggers for flares of the disease. Do you want to help out?
Yes, I think the key point is that, especially for a rare group of diseases like the different forms of vasculitis, a patient support group such as Julie's that she's established, the VINE group, the VIA group, has been really critical for raising awareness among patients, and I think helping link patients together. Many of them, think that they're the only patient with this disease, and unfortunately, a lot of the time, it's actually might be true for that clinician that's treating the patient. I don't have any other patient with this disease, etc. So I think in terms of helping to link patients to centres that have a clinical interest in the conditions, but also that have a research interest and that facilitate the patient's involvement with the research has been really important. And I think I've certainly found that vasculitis patients in Ireland are very enthusiastic about participating in registries, clinical trials, other research efforts, because they're aware of the shortcomings of our existing standard of care and what we know at this point, and the need for further research. So there certainly have been a very engaged group, and Julie's group have annual meetings which facilitate discussion between clinicians and patients, and research updates, etc. So that collaboration with Julie's group has been really important for us, and she and Mark Little and others are involved in this VINE group, and the Vasculitis Ireland Network, which we hope will be acknowledged as a European reference network through the rare disease programs.
I think, another thing, I was very lucky to get on to the UPATI program that was run here, and the reason I enrolled in that program was because it was about research and intervention, and for us, at the time of that course coming along, I felt I was at the end of the treatment scale. I didn't know what was going to be on board for me, should I have another flare, and it was going to be very hard to control. So I wanted to know, was there anything that I could do to help this process? So I did this course to try and understand the whole how it all works. Is there anything that patients can do to help themselves? And I found that very beneficial. I have an understanding of the language that clinicians and scientists know. I'd never say that I was a clinician or a scientist or anything like that, but at least I understand what's being said now, and then I can feed back what's being said to the patient group, which I found very, very helpful.
So, go ahead.
Oh no, sorry, I was just going to say, I think one thing that would potentially be useful for patients, and potentially also for their GP or other healthcare providers, to help patients participate in research or identify centres that are engaged in research, is for a website that has a list of diseases, of studies, of centres participating in research, etc. And that would help that, because I think the awareness and the difficulty in accessing the information is really difficult.
Yes. Okay. If all the other groups can follow the example of this particular group in terms of just, I think what you've both spoken about is basically how you've both been empowered, I think, as part of the experience. I think obviously I'm very familiar with the UPATI initiative, and that was set up to provide that kind of neutral information, which I think very often isn't actually there online. But I do think that also with the changes in the clinical trial regulation that are coming through next year, you will see a lot more patient-centric information coming forward particularly about clinical trials. So that environment is improving in Europe. So with that example, I'll move on to the next, if that's okay. Does anybody have any specific questions at this stage? We can probably open it up at the end. So our next pair is Michael Griffith, who is the first chairman of the MRCG. He's also the first chairman of IPOSI, and He's someone I know very well, and he's the co-founder of Fighting Blindness. And Michael has been working with Dr. Paul Kenna from Trinity College Dublin for many years, both in the area, particularly of research into retinal conditions. So, Michael, if you'd like to maybe introduce your experiences.
Thanks very much, Derek. Well, thanks. It's nice to be back at an MRCG meeting. I haven't been at one for at least 8 years since I retired from Fighting Blindness. And they say that when you retired, you're remembered for about 5 years, and so I thought everybody had forgotten about me at this stage, so it was nice to get an invitation back. And it's great to see that MRCG are still doing such wonderful work, and really very active. It's a wonderful feeling. Now, Grace asked me to share my experience of my work with Fighting Blindness, which is a 33-year experience, in 5 minutes. So I said, no problem, Grace. So let me try. I was diagnosed with the degenerative genetic retinal condition, retinitis pigmentosa, when I was in my late teens or early 20s. At that stage, I had no symptoms, but my father was affected, and his brothers and sisters, and my brother and my cousins, and it was all over the family. So being a young man and being asymptomatic, I really didn't have an awful lot of interest in blindness at that stage. I was more interested in other things that young men are interested in, like drinking pints of Guinness and chasing the fairer sex and things like that. And so I didn't really do anything about it until in my mid-30s, and my father began to get a lot worse, and I kind of felt sorry for him, and I felt that maybe if I started a self-help group, it would help him a little bit. And so I got in touch with other people who suffered from retinitis pigmentosa, and the result was Fighting Blindness. And then we went to our first international meeting in 1984. Sorry, that was 1983, I should explain. And in 1984, we went to Helsinki to our first international meeting of other retinal groups from other countries. And that was a very exciting meeting, because at that meeting, an Indian scientist based in the UK, Shomi Bhattacharya, announced the first major genetic breakthrough in research into retinitis pigmentosa. And I got friendly with Shomi at that meeting, and he agreed to come back to Dublin to help me to start some research in Dublin. He vaguely knew the then head of the research department, Dave McConnell, and he came over and we went in to see Dave, and to Dave's credit, he agreed to do a preliminary research study, a 1-year study, and it would cost £10,000. And so we came up with the £10,000, and Dave came up with a postgraduate researcher by the name of Jane Farrer, who was on her way to Belfast to join a cancer research project, and she's now Professor Jane Farrer and still in the genetics department in Trinity College. And so she did the 1-year research project, and on the strength of that, and in the meantime, we had been able to raise over £100,000, and we asked the team in Trinity to put a project proposal to us, and we had it internationally peer reviewed, and we gave them £100,000 over 3 years. And then we got in touch with our American sister organisation and persuaded them to give the Trinity project $500,000 over a 5-year period, and that was huge money in those days for research, and it got them off to a flying start, and fair enough, they delivered, and by 1989 they became the first group in the world to announce that they had found a gene for retinitis pigmentosa. And so that was a big world first, and it justified all the money that we had put into that project. And then that project continued on over the years, and it developed into a gene therapy project, an interesting one because it was gene therapy into dominantly inherited retinopathies. Most of the gene therapy that's done in the world is done into recessively inherited conditions, because you'd only have to replace the defective gene in those conditions, whereas with dominantly inherited conditions you also have to take out the mutant gene before you replace it with a good copy of the gene. So the Trinity group were really the leading group in the world looking at this, and it eventually developed into a campus company called Genable, and we invested in the campus company, we kept it going, and only recently the company was sold to the leading US gene therapy company, Spark Therapeutics, and we were happy with that because it has its best chance of going to market by being sold to that group in America. We got to the stage here in Ireland where I think it really couldn't have been taken any further, and the nice thing about selling it to the American company was that we also recovered our entire investment in the project, and so we were able to have a little bit of money to put into further projects. So in the meantime, we'd also started several projects around the country, in UCD, in Waterford, in Cork, and we're currently talking to Remedy, that's the stem cell arm of research in NUIG. And so we have a lot of research going, and we have achieved a lot over the years. Have we a treatment? No. Am I disappointed? Absolutely. I think at one stage we thought, after the Trinity breakthrough of 1989, we thought that we'd have a treatment within 5 years, but we were a bit naive, I think. So would I do the same all over again? Maybe slightly differently. Maybe we'd focus a little bit more on one project and put more energy into it, and probably be a little bit more pushy and a little bit more demanding. And I have to say that Mark Pollock spoke at one of our annual general meetings some years ago before he broke his back, and he was very inspiring then, and he was even much more inspiring today. And I think that if we had more of Mark's spirit and kept pushing the boundaries, I think we might be able to achieve results a little bit more quickly. And I suppose the takeaway message from me today would be, I would like to encourage those involved in promoting research through the charities to push, and don't take no for an answer, and don't be discouraged. Just keep pushing. Thanks.
So I might ask Paul.
Michael has actually told my story, but I'll maybe add some other aspects to it. I'm delighted to be at this conference actually. Now I have to admit that it's only very recently I've heard the term PPI, but actually in retrospect, and Michael has told the story, patient involvement actually in the work that I've been doing has been, the work simply wouldn't have happened without that involvement. I was recruited in 1988, so relatively shortly after the RP Society Fighting Blindness as it is now was founded by Michael and Paddy Byrne and others, with the prospect of only spending 2 years actually at the research and then going back full-time into clinical ophthalmology, but that's not actually the way it turned out. So I've been involved in the research department in the INDR hospital, where we've been clinically characterising patients who have been involved in the research over the best part of 30 years, but also in the optogenetics unit in Trinity. And I was a founder of the Geneva company that Michael spoke of. But the involvement of patients has been absolutely critical to the work that we've been doing. In genetic research, it simply is impossible to do that sort of work really without really intimate patient involvement. So I've come to know many hundreds of patients with a variety of retinal degenerations over the years. And not only are we developing, or at least trying to develop a treatment for rhodopsin-linked dominant RP, which Michael spoke of. But with the advances in technology now, the capacity to identify disease-associated gene mutations has become much, much more sophisticated, and also was considerably cheaper than it used to be in the past. And one of the big projects which we're doing at the moment, which comes out of the work that we were doing in Trinity and is very, very strongly supported by Fighting Blindness, is a gene sequencing initiative to genetically diagnose actually Irish patients with inherited retinal degenerations, to get them ready for the prospects for gene therapy. While there's only one approved gene therapy for single inherited retinal degeneration identified at the moment, I think over the next 10 years there certainly will be many, many more. And we have an example actually of the significance of that patient involvement and the very, very strong support of patient-led organisations such as Fighting Blindness in that work, in that we identified a gene actually as part of that initiative, and that led directly then to the identification of a therapeutic trial that Irish patients could become involved in. And I'm glad to say that was the first, it wasn't a gene therapy trial, but it was a gene-directed treatment trial in any form of dominant RP. So that is a development which, when I started back in 1988, I never thought I would still be working actually when that would happen. So, as I say, even though I'm a novice to PPI, I actually have been involved in it for the best part of 3 decades, unknowns to myself.
Thank you, Paul. I think that's a wonderful synopsis. I think that's a very, very concrete, clear example of a patient organisation who was not only began the funding initiative, but has been continued to be involved throughout the process.
Absolutely, and it's been absolutely critical to it.
Yeah. Okay, in the interest of time, I know we're running a bit short. I'm going to give the following 2 as sufficient time as the previous 2. So the next pair is Dr. Marguerite Hughes, who is the Vice President of the International Prader-Willi Syndrome Organization, but is also a social researcher in her own right, but I think she's here as the patient representative. And Marguerite is here with Louise Gallagher from Trinity College. So maybe, Marguerite, if you'd like to introduce your own experience.
Sure. I am here. I am the Vice President of IPSO, but I suppose the main reason I'm here is because until recently I was on the board of the Prader-Willi Syndrome Association of Ireland, and we were involved in a piece of research that I was asked to speak briefly about. So PWS, or Prader-Willi Syndrome, is a rare chromosomal disorder. We can't be absolutely sure of numbers, but since genetic testing began in Ireland in the mid-1990s, we know that around 100 people have been diagnosed here. Some of those were who were quite old at that stage. So we think in terms of around 100 people in Ireland having Prader-Willi syndrome. It affects a lot of areas of people's lives. It affects appetite, growth, metabolism, cognitive function, behaviour. Because it's rare, most people know nothing whatsoever about it, as you would expect. Those who have heard of it typically know only about one characteristic, which is something called hyperphagia. So this is an insatiable appetite or drive to eat. So for most people, but not all, because there is variation of course, for most people with Prader-Willi syndrome, environmental controls are necessary to prevent overeating. So I have a 12-year-old son who has Prader-Willi syndrome. Certainly in our house, the kitchen is locked at all times. When he goes to school, all lunch boxes in his class are locked at all times. So the Prader-Willi Syndrome Association of Ireland was set up as a support group in the late 1980s. At that time, there was really a tiny number, a handful of parents who had children who had been diagnosed with PWS. It is now a very active but totally volunteer-run association. On its contact list, coincidentally, there are 100 names of families in Ireland, which is around the number that we know have been diagnosed. So I'm sure we're missing some, but certainly it seems reasonable to think that the majority of families in Ireland have been in contact with the association at some point. I think for a long time, the PWSAI has been conscious of a need to produce empirical data on needs and also to tell a story about how people with PWS and their families live in Ireland. So I have a very strong recollection of an event 12 years ago when, shortly after my son was diagnosed, I was told to apply for a discretionary medical card for him because this person rightly told me that I would have a lot of medical costs. I went into a community welfare officer, sat in front of her and said, I would like to apply for a medical card for my son because he has Prader-Willi syndrome. She looked at me with what I interpreted as a rather bored expression and said, never even heard of it. And I'm not surprised she hadn't heard of it. I hadn't heard of it myself until a few months prior to this. But in that moment, and so many times since then, the onus has come back to me. The burden has been on me as the parent to prove this thing exists. It's real. It has impacts, it has significance, and as such, people who have this syndrome are deserving of support. And I think that's quite a heavy burden for families. So I'm here to talk about a large, extensive survey that we asked Louise Gallagher and her team to help with earlier this year. So one reason why the association thought this was necessary so that we would have a calling card. So the families in that position could say, here you go, this is what Prader-Willi syndrome is. This is how people with PWS in Ireland are affected by it and what they themselves perceive their needs to be. So if I remember rightly, it was late last year, we contacted Louise because we were aware of her work on an autism registry, and we thought there would be some overlaps. And we asked her to assist us with a study that would tell the story of how people with PWS live. We wanted it, as I say, as a calling card. We also wanted it very much as a tool to facilitate advocacy, both by the association and by individual families. So members from the association met with the then Minister for Health, Leo Varadkar, last year. And I think there was a great consciousness on the part of the association during that meeting that while they had a very strong sense of what people's needs were, they had no data whatsoever to back this up. So that was necessary. In particular, we were looking for additional long-term residential places, because there has only ever been one PWS-specific residential house initiated in Ireland, which is back in 2002. And there were a lot of families coming and saying, we need places, we need places, we need places. And we knew people need places, but we had no evidence. Who are these people? Where are they? How many are there? When do they want these places? So we wanted to have evidence. We wanted also families to be able to better advocate for their own family members. So if you're in an area where a special educational needs organiser is saying children with Prader-Willi syndrome don't get SNAs, you can say, well, I'm sorry, actually, they do in these cases. So we wanted to give people information to help them to help themselves. What did we ask about? We asked about everything you could imagine, from diagnosis history to developmental progress to educational attainment, medical services, medications, living experiences, impact on the family. So it was a very long instrument, 29 pages of questions. We expected it would take about an hour for each family to fill it out, and an hour going back to filing cabinets to go, when did that happen again? So this was a big undertaking on the part of families. The association, I think, was involved from the start. We wanted, as a group, this to happen. And we said, we will get you the participants. And in the end, 61 families completed the survey, which out of 100, I think is reasonable. We were delighted with how everything worked with Louise's group, which she'll speak about. Other stakeholders were brought in, which we thought was really important. For example, there's a professor, Edna Roach, who leads the largest endocrine PWS-specific clinic in Dublin. She was an important collaborator. We involved people from rehab care who provide PWS residential facilities. So we brought a lot of people together, and I think we felt that we had a significant impact on the project. And the final report isn't fully written yet, but hopefully it'll be on our website within the next couple of months. And obviously you'll be welcome to take a look if you're interested. Mm-hmm.
Louise, thank you very much, Margaret.
Mm-hmm.
I couldn't do a better summary of the whole process, and I think that has been characteristic of our engagement around this whole project with PWSAI. By means of sort of background, I'm a researcher in Trinity, and I'm also a clinician. I'm a psychiatrist, and I think, like other people on the panel have said, I've been involved in PPI probably for years as well, but I never knew I was doing it. And so I suppose a lot of my research focus tends to be more on genetics and neuroimaging type of research. So it's much more basic research rather than the kind of applied research that we've got involved with PWSAI. And I suppose our pathway of my research group into this sort of area has been probably driven very much by reflecting on what the needs are of people with neurodevelopmental disorders like PWSAI. Unlike maybe a lot, PWS is slightly different because obviously there is an identified genetic cause for the condition. But for a lot of neurodevelopmental disorders, there aren't necessarily known genetic causes, and people are a little bit less interested in basic research, and they struggle a lot with the sort of issues that come up for people with PWS. in Ireland. So for a number of years now, we've been very interested in trying to tap into what motivates people to participate in research, and are we asking the right research questions. So Marguerite would have been involved in our previous efforts to set up the registry, where we'd had a 2-year stakeholder engagement around that, and that really sort of defined what the focus of that registry should be. And I think that kind of highlighted also for PWSAI that many of the sorts of broader needs that a registry can address, in addition to the kind of maybe medical or research needs, can be often shared across different groups. So in terms of, so I suppose one thing I would say is that my involvement with patients and families around research and trying to engage people with research has probably taken me in places where I didn't expect to go as a researcher, but has been very enriching. And certainly I would say that specific to the PWS project, well, Marguerite has been fantastic in driving that project. So in terms of having somebody within, the charities group or an advocacy group for a condition, driving that process has been really, really important to getting it done, bringing the right people in, and informing and shaping the questions that we were. And actually, everybody brought expertise to it, So I had I was very interested in the mental health and behavioural needs. Professor Roach is very interested in the medical needs, and I hope that we've done something very comprehensive as a consequence, which will be of use both kind of from a research point of view and informing the organisation, but then also maybe to impact on policy. And I suppose that's something that's really, should be a driver for our research. What I would just kind of like to also highlight as well, that it was great to hear from the HRB about developing how we think about PPI and supporting methods for this, because I think in looking towards the future as a researcher, it is really, really important. And, if you're writing European grant applications, the European Union really wants to see that level of stakeholder engagement, shaping kind of specific questions in the research projects that you're undertaking. And so I think it's really important that we engage with it, and that we develop more skills so that we can do it more effectively.
Thank you very much. I'm going to give a final opportunity now for the final pairing. So that is Alexis Donnelly, who is, again, remarkable that all of these patient representatives here are all qualified researchers in their own sense. Alexis is here as a person with MS, and he is here with Professor Michael Hutchinson, who is a consultant from St. Vincent's Hospital in Dublin. So, Alexis, if you'd like to begin.
Okay, I've had primary progressive MS for the last 25 years. I don't know how I'm going to follow the talks that we've just had there. Really kicking me into the halfpenny place. But I feel, on a serious note, my journey with PPI is really only just beginning, and I've learned an awful lot from the people who spoke this morning. The problem with progressive MS is that there's been very little research done on it. We have a plethora, well, not a plethora, but we have about 15 new medications that address relapsing and remitting MS, which is the earlier stage where the disability comes and goes. But there are a few privileged people like myself where it comes and never goes. That's primary progressive. And then even the people with relapsing and remitting eventually transmogrify into a stage called secondary progressive, and where the disability stays and gets worse. And we don't know what kicks the whole process off, and we certainly don't know what is going on really in progressive MS. There are hints, but it's very hard to measure whether a medication is making any difference in progressive MS. because you have to wait a long time and you have to see whether your disability is progressing faster or slower than your peer group, so it's quite tricky. Now, I've also served on the research committee with Professor Hutchinson of MS Ireland, where I learned my trade, I suppose. It forced me to do an awful lot of reading. And the discontent, I suppose, with the lack of work generally being done in progressive MS compared with the relapsing and remitting drove me to get involved with an international initiative called the Progressive MS Alliance, which is basically a coalition of 5 big MS societies from the UK, the US, Canada, Italy, and I think the International MS Federation. And MS Ireland has been involved, it contributes what it can, and there are about 15 MS societies altogether. So these MS societies were, like myself, fed up with the lack of work being done in a coordinated way. So they put up a lot of their own money. We have 20 small projects running for about a year and 3/4 now. There were, I think, 195 applications for that funding worldwide. The idea was to get the best of science focused on this. And then they announced a bigger award for international collaborative networks. And they were, there was about 95 applications for that. They were whittled down to 11 finalists who were each given €50,000 to develop a bigger proposal. And 3 of those have been announced and awarded in London at a big MS conference very recently. So I've been lucky. I've been involved in the main scientific steering committee of that organisation with 2 other people affected by the progressive version of the condition, a lady from Glasgow and a carer from Los Angeles, whose wife had a very serious version of progressive MS. And there are about 40, I think, if you get the whole committee together, scientists, both basic scientists and clinicians who'd be mainly neurologists, involved on that committee. So it's incredibly exciting, as you might imagine, incredibly empowering and incredibly humbling, because you have to scramble to keep up with them. But as many other speakers have said, you can bring the punter's view, the view from the pew, and it helps to shape the direction of the research. And I was really impressed both by the quality of the proposals before us. I'd never seen anything like them. They were amazing. But also I've been very happy to see how attentive all the researchers are. If you're at a meeting and you don't understand something, you can nudge someone and say, explain that. And likewise, you can intervene at a critical point in a discussion and say, well, that's very interesting from a scientific point of view, but it's not going to much use, and then you get someone else coming across the table and say, well, if we knew the answer to that, then blah, 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 and it will be very useful. So the kind of exchange that I think Anne outlined, where you have equal partners around a circular table rather than a rectangular one. I noticed that in the pictures. It resonated with me, the fact that a lot of the tables were circular. And one of the things actually seeing all these pictures of aeroplanes reminds me of a news item on Morning Ireland a couple of weeks ago, where there was a story on extending or adding a third runway to Dublin Airport. And the existing planning permission has certain limited hours after which planes must not land. And of course, Dublin Airport Authority want to extend these hours and build another runway. And the local residents are not too impressed with this. But the lady from Dublin Airport Authority came on and said, now this is our plan, and it underpins our commercial plans for the next 10 years. We have to get these runways opened up and flying before such and such a date. But in the meantime, we will consult with the residents. That is not how you do consultation. So the kind of welcome I've experienced in the Progressive Alliance and in MS Ireland, you realise this is the way to do it. It's called PPI, or I think Anne probably has a better name for it, which escapes me at the moment, but you had a better three-letter acronym, which reflected the equality of the discussion and the exchanges. Where are we in Ireland? I think we're probably a way behind the leaders, but we have two good things going for us. People have gone ahead. We can learn from the best of their experiences and from the worst, what to do and what not to do. And in Ireland, I think we have a genius for networking. Okay? If you want to, get in contact with Rory McIlroy, somebody knows somebody who knows somebody who knows somebody. And we get to it fairly quickly. There are a couple of things we could do in Ireland. We could have a human tissue bill passed. We could have the health information and protection bill passed. We could set up some tissue banks. We could, certainly in MS anyway, set up a clinical trial network. Because you see all these wonderful initiatives taking place internationally, and you kind of know it's going to be hard for Irish people to get access to that. So there's a lot of good things we can do looking forward, and I would see MRCG and IPOSI as leaders in that space. And I wouldn't be afraid to, because structures aren't there. Structures aren't there, you're starting with a blank canvas. Draw what you want and do it. I think I wouldn't be at all abashed by the fact that we have very little in the way of structures. So that's going to.
Well, Alex, thank you very much. I've got two hats. I've got a multiple sources hat, and my other interest is dystonia, and adult onset dystonia. And going back to what Anne had said, I think, in fact, a real impetus for PPI was the KEDS, the Knowledge Education Dissemination Scheme, funded. We had a most successful year because of it. It actually, this is the dystonia hat I'm wearing, sorry. So it's a rare disorder. There's only 600 to 650 people with dystonia in Ireland, and bringing a significant proportion of those people and their families into a room to hear national and international speakers actually has been a fantastic stimulus for research. And so I wouldn't downplay that role in relation to the PPI thing. In relation to MS, I mean, basically, so we have had relatively low-level basic research in multiple sclerosis in Ireland. And in fact, a lot of had been industry-driven involvement in trials, RCTs, international trials in relapsing MS. And clearly the need for people with progressive multiple sclerosis was there. A number of drugs have been tried and have not worked. So basically, and that has been, I mean, that has been the most significant event in the last 5 years in MS, is the formation of an international organisation, Progressive MS Alliance. And we're extremely proud that Alexis is our Irish representative, and from what I hear, works exceedingly hard in committee. And so, but actually what happened basically was, so it was easy to see the lesions of relapsing multiple sclerosis and measure them. It was not easy to measure the deficits at an MRI level, for instance, or as a biomarker level of progressive MS. This is all happening, and it happened and is happening and improving in the last 5 years. So there has been this good coalition of demand from people with progressive multiple sclerosis, and also a coalition of researchers, imaging and biomarker. For instance, now at one stage you could only measure CSF by doing lumbar punctures, neurofilaments. Now we can measure neurofilaments from breakdown in the brain, in the serum now. So this has happened in the last year. So there is this convergence of unmet need and desire for something to be done about this disorder, and also the technical achievements in relation to both MRI scanning and biomarker research. So it is. I think the MS Progressive MS Alliance has been one of the great success stories in relation to MS research, and you know, I think we're going to see, and already, as Alexis mentioned, there was a conference 10 days ago in London, and it is clear the whole ground in MS is changing rapidly to be able to reduce progression and actually delay the onset of progression and reduce the rapidity of progression. So the future is looking very good there, and that I think is due to that combination of the science and the persons with multiple sclerosis involvement in driving that forward. So,
thank you. We're over time, so I'd just like to close the panel discussion, but to thank each one of our panel members, all of the pairs for their contributions today. I think we have to move it on. So a round of applause for everybody.
Just to joyfully close the conference, just to thank Derek, and I think that was one of the best panel discussions I've ever seen. It was not only informative, but it was extremely moving as well. So a round of applause again. We've captured, Pat is going to be writing up the day's proceedings, and we've also captured it on live stream as well, so you'll be able to look back on our websites, respective websites. But you can rest assured that MRCG and IPOSI and all of us here today will be bringing forward PPI agenda in a very strong way, and it's great to hear the responding and support for it as well. So just thank Mary and Grace and Linda for organising today. Absolutely, I think it was one of the best events I think that I've been involved in since I've been involved in MRCG. and the quality of the discussion and participation. So just to thank you again. And there's a light lunch, I believe, outside as well, so please take that. Thank you.